It was just past noon on February 18th, 2024, when a 55-year-old man was rushed into the emergency department of a small district general hospital in the northwest of England. Paramedics reported sudden onset facial droop, slurred speech, and weakness on his left side. To anyone watching, the signs were unmistakable, a stroke in progress. Within minutes, doctors activated the stroke protocol. Time was everything. Every second meant the difference between recovery and permanent disability. He was awake, responsive, and frightened. His words came out slurred, his left arm felt numb, and his gait had turned unsteady. When the medical team checked his vitals, everything looked surprisingly stable. Heart rate in the 80s, blood pressure a bit high at 168/98, but no signs of immediate collapse. A rapid CT scan ruled out bleeding in the brain. That meant it wasn't a hemorrhagic stroke. It was most likely ischemic, the kind caused by a clot blocking blood flow to the brain. He was given aspirin immediately, as per National Stroke Guidelines, and a high-dose statin to protect his blood vessels. But the real mystery began with what doctors didn't see. There was no obvious source for the stroke, no high cholesterol buildup, no atrial fibrillation, no cardiac defect. He wasn't a smoker, had no major health issues, except mild asthma, and drank moderately. To the team, he didn't look like someone who should have had a stroke at all. The next morning, an MRI confirmed what the CT had missed. Multiple small strokes scattered across the right side of his brain. They affected areas responsible for coordination, speech, and fine movement. The distribution was irregular, not the pattern seen in most clot-related strokes. This raised a red flag. Something else was happening in the blood vessels supplying the brain. A Doppler ultrasound of his neck revealed something strange. Turbulent blood flow in the right carotid artery, one of the brain's main highways for oxygenated blood. Then came the CT angiogram, and the mystery snapped into focus. The images showed a long, thin tear in the lining of his right carotid artery. The vessel wall had split open, creating a false channel inside it, a deadly condition called carotid artery dissection. Blood was seeping into the wall of the artery, forming a clot that gradually blocked blood flow to the brain. The scan even showed a telltale flame sign, a visual clue radiologists instantly recognize as a hallmark of dissection. In essence, the man's own artery had betrayed him. The diagnosis explained everything: the multiple small strokes, the lack of traditional risk factors, and the progression of symptoms. Doctors concluded that small pieces of clot from the dissection had broken loose, traveling upward and blocking different areas of his brain. He was started on a strict medical regimen: antiplatelet therapy with aspirin, high-dose atorvastatin to stabilize the vessel, and continuous monitoring. The situation appeared under control until 24 hours later, when everything took a terrifying turn. During the second night of his hospital stay, nurses noticed he was becoming weaker on his left side again. His arm barely moved, his speech worsened, and his face drooped more heavily. Another CT scan revealed new infarcts, fresh strokes in the same area, now larger and more destructive. The dissection had continued to throw off emboli despite medication. By this point, the doctors classified his case as a stroke due to non-atherosclerotic arteriopathy, meaning it wasn't caused by cholesterol or plaque, but by the tear itself. Surgical repair was considered, but neurosurgeons decided against it. The risks outweighed the potential benefit. The best course was close monitoring and aggressive medical therapy. But then came an unexpected complication, one that no one saw coming. Late one evening, while nurses were checking his vitals, the heart monitor suddenly flatlined. The patient's pulse vanished. For nearly 15 seconds, the ECG showed nothing, just silence. Moments later, his heart rhythm returned. He gasped and blinked awake, unaware of what had just happened. At first, the team suspected a monitor error. But when it happened again, Lasting over 20 seconds, panic set in. Cardiology was called. Telemetry revealed that his heart was entering repeated episodes of sinus bradycardia and prolonged cardiac pauses, moments where the heart stopped beating altogether. He wasn't on any heart-slowing medications. Electrolytes were normal. The cause was elusive until the doctors connected the dots. The dissection wasn't just blocking blood flow, it was interfering with the carotid sinus, a small but powerful structure in the neck that controls blood pressure and heart rate. Stretching or damaging this area can trick the body into thinking the blood pressure is too high, triggering a reflex that slows the heart or even stops it temporarily. The phenomenon is called carotid sinus hypersensitivity. And in this man, it had reached a deadly level. Despite intravenous medication to stimulate the heart, the pauses continued. At one point, his heart stopped for 26 seconds, long enough to cause loss of consciousness and, potentially, sudden death. The cardiology team made the call. He needed a permanent pacemaker. Without it, the next pause could be fatal. On the 9th day of admission, surgeons implanted a dual-chamber, rate-responsive pacemaker. As soon as it began pacing, the rhythm stabilized. The silent pauses vanished. The constant fear of cardiac arrest lifted almost instantly. With his heart secure, focus shifted back to his brain. The damage was significant but not devastating. After intensive physiotherapy, he began regaining partial strength in his arm and leg. His speech improved with therapy, and he could walk short distances with support. After nearly 3 weeks in hospital, his recovery was progressing. Medically, he was finally safe to go home. But that's when the story took a turn no one could have predicted. As part of routine discharge, the hospital staff attempted to contact his next of kin. The number he'd given led not to his wife, but to another woman which he was seeing. She arrived at the hospital claiming to be his emergency contact. She introduced herself calmly, familiar with his condition, and signed paperwork for his care. When the staff referred to her as his wife, she hesitated. Then quietly, she explained the truth. She wasn't his wife. She was his mistress. According to her, they had been spending a quiet weekend away in the Northwest when he suddenly collapsed. She had called the ambulance and followed him to the hospital, all while his real wife, living several hours away, believed he was away on a business trip. Behind the hospital's sterile walls, the situation grew tense. Staff were bound by confidentiality, but as discharge planning continued, the truth inevitably surfaced. When the hospital attempted to update his official next-of-kin records, his legal wife was finally contacted. She was blindsided. For years, she had believed her husband was faithful, devoted, and predictable. Now she was faced with two devastating truths at once: that he had nearly died and that he had been living a double life. The man, still recovering from his strokes, was caught in the fallout. His condition remained fragile. The stress could have easily worsened his symptoms. Nurses described the atmosphere around his ward as somber. He spoke little, focusing on his rehabilitation. His pacemaker ticked steadily beneath his skin, a constant reminder that he had escaped death by seconds, but at a cost that went far beyond the medical. When he was finally discharged, it was under the joint supervision of neurology and cardiology teams. He left with a permanent pacemaker, a lifelong prescription for clopidogrel, and a rehabilitation plan tailored to help him regain as much function as possible. His prognosis was cautiously optimistic. With continued therapy, he could walk independently and regain speech clarity within months. But as one of the neurologists later noted, his medical records now told a story that was both rare and haunting. A perfect storm of two rare syndromes striking at once: carotid artery dissection and carotid sinus hypersensitivity. One cut off blood to the brain. The other shut down the heart. Either could have been fatal. Together, they created a medical crisis unlike anything most doctors ever see. From a purely clinical standpoint, the case became a reference point, cited as an example of how vascular injury in the neck can trigger severe autonomic dysfunction. The medical literature described it as a collision of two rare entities, where mechanical distortion of the carotid sinus produced reflex bradycardia unresponsive to standard treatment. The decision to implant a pacemaker wasn't just appropriate, it likely saved his life. But beyond the scans and statistics, the story carried a very human dimension. He had entered the hospital fighting for his life, but in doing so, he'd exposed a secret that changed everything outside it. His recovery would take months, maybe years, but his personal life would never fully recover. Doctors see many things: broken hearts, broken vessels, broken trust. This case had all three. It served as a reminder that medicine doesn't just expose disease. Sometimes it exposes truth. He survived one of the rarest vascular catastrophes known to medicine, a tear in the artery that nearly stopped both his brain and heart. Modern treatment, fast action, and teamwork between neurology and cardiology saved him. But in the process, something else was uncovered. The life he'd built around careful lies unraveled in the bright, sterile light of the hospital ward. He walked out alive with a steady pulse and a second chance. Yet behind the quiet hum of his pacemaker, there was a heartbeat that no longer carried the same rhythm because survival had come at the cost of exposure. Medicine saved his life. Fate revealed his truth. And somewhere between those two moments, between the silence of a stopped heart and the steady beeping of recovery, a man learned that sometimes what nearly kills you is the same thing that uncovers who you really are. What do you think? Was this man's survival a miracle, or the moment his double life finally caught up to him? Share your thoughts in the comments. And if you want more real stories where health meets hidden truth, make sure to like, subscribe, and hit the bell icon, because the next case might reveal something even more shocking.